If a model is available, or if the clinical situation is difficult, you or your dental technician can adapt the FOS splint on that model. Because of the low thermal conduction rate, the splint is heated slowly with a hot air gun to soften the polyester. For this, we use a small hot air gun from a hobby shop. The unit reaches temperatures of approximately 450 degrees with an 8mm tip. First, we desire an improved general adaptation. Set the heated splint onto the model and press it firmly to place. To optimize the fit of specific areas, you can work directly on the model. The softened polymer can be adapted with an instrument such as the wax spatula shown here. There is some memory effect, so maintain the pressure until the splint is cooler. Within a few minutes, you have a splint with improved adaptation, and it is ready for relining. Visit our website for further information.